Your blood sugar readings can actually be inaccurate sometimes. And today we'll find out why that happens. What actually affects the accuracy of readings and how can you trust a glucometer if it's sometimes wrong? We'll cover all of that in today's video. My name is Maxim Kuznetsov. I'm an endocrinologist. So let's get started. The most common mistake I see among all diabetics is not measuring sugar at all. Here's my favorite comment from one of my videos. The main trick is just never picking up the glucometer and your glucose is always fine. I mean, I agree. If someone's decided to go blind, why would they need a glucometer? Understand that for a diabetic, there are three indicators we watch very closely. Those are sugar levels, blood pressure levels, and your cholesterol levels. That's the absolute baseline. This is the most common cause of mortality among diabetics in general. If you don't measure your sugar, you are actively inviting lower limb amputations, heart attacks, strokes, blindness, and severe kidney or liver disease. Diabetes doesn't forgive things like that. Believe me on this. I worked in an ER for many years, not 300 years, obviously. Yes, I'm not gray-haired, but long enough. And I've seen a huge number of even young people who didn't control their sugar and got all these severe complications, and they could have been avoided if they just managed their diabetes in time. So, first of all, let's get this totally straight. The glucometer that all of you watching this video have, I hope, was never designed for making medical diagnoses. If you have a guest over and they check their sugar just out of curiosity and see it's really high, that's not a reason to diagnose them with diabetes. Because a glucometer by its very nature has margins of error, well, that's just how it's built. First of all, it's generally very bad at detecting low sugar in people. Second, there's a built-in margin of error simply because it takes blood from your finger, which is purely capillary blood. The further away you are from the systemic blood circulation, the more errors you will get. You could even take, I don't know, two completely different glucometers, test the exact same drop of blood, and the readings will still differ slightly. If anyone has actually tried doing that, please let me know in the comments how you handled that situation. But it's a very common story. It's not that glucometers are bad, it's just how they're made. They have a small range, a small margin of error, you just have to keep that in mind. And when we make diagnoses, we look at blood from a vein, from the central circulation. Because in a finger, who knows how much things can constantly fluctuate? In the systemic circulation, everything is usually more or less stable, though there are nuances there too. In principle, if you measure sugar in different areas, like from lung vessels or near the liver or elsewhere, the sugar levels will be slightly different everywhere. But we as a medical community have agreed to look at the cubital vein. That's the one they always take your blood samples from. And there we have an idea of what the glucose level should be. Norms? Yes, I'm not stating glucose norms here because there's a different norm for every person. Your personal endocrinologist should have told you exactly what your own personal normal sugar level is. I tell all of my patients exactly what their blood pressure, sugar, and lipid levels should ideally be because it is all completely tailored individually. For example, an 18-year-old boy and a 70-year-old lady might have very different target sugar values. That's also something to keep in mind. Well, I have mentioned peripheral blood flow. It's a bit of a mess here. Even if you just warm up your finger or put it in ice cold water, the vessels will spasm after the cold, right? The blood just doesn't reach there. And when you prick your finger and check, you'll see the sugar is a bit lower than it actually is, simply because the blood flow didn't get that far. Many diabetics who've tried, checking their sugar in winter can confirm what I'm saying in the comments if they want, but I think they will. Don't think I'm only here talking about mistakes. At the end, I'll give you a clear algorithm on how to measure your sugar. So make sure to watch until the end. There's another interesting reason why sugar might be artificially high, and that's if your hands are dirty. We all know that, well, you need to wash your hands, right? At least just with some soap, dry them off, and only then draw the blood. But in my practice, I've seen folks who just ate honey, syrup, well, something sweet and sticky, and then immediately check their sugar, right? And see it's high. Well, I think it's clear why. Because that drop of blood, it actually touches the skin. And if any sugar remains on the skin, it gets absorbed into the blood. And of course, your meter shows that the sugar levels are elevated. It's the same, common story in hospitals where if for some reason a diabetic is given a glucose drip, which happens, if they faint, it happens that we give a diabetic glucose. And if you're getting glucose in this arm, and then a nurse comes and takes a sugar reading from a finger on that same hand, we see high sugar levels. Well, because that highly concentrated glucose solution is spreading in both directions right here, and we get a massively artificially high sugar reading. And then they call me in the middle of the night, saying we have a new case of diabetes here. Turns out, what should we do? Well, you need to study properly at university. The nurse needs to use basic logic and not take glucose from a finger on the arm receiving a glucose drip. Actually, I'm telling you all this because measuring glucose is a critically important task for a diabetic. If you don't do it, we can end up with a bunch of different complications that I've already mentioned. You could get vision impairment, heart attacks, or sudden strokes. Those constant, pains in the legs. It's called paresthesia, that nasty, unpleasant feeling of constant soreness in your feet. Another reason why a glucometer shows incorrect sugar levels is because it's ancient. You might be surprised, but any piece of equipment requires calibration, and a glucometer is no exception. If you've been using the same glucometer for 10 years now, I beg you, either replace it, let it retire, or at least go to a lab and check it. Well, if you actually are a diabetic, you should ideally go for a comprehensive annual checkup with your doctor every year, and your insurance likely covers it. If you didn't know, yes, with type 2 diabetes, to go to the doctor's office to have your therapy properly adjusted, and there you just ask the doctor's lab and say, look, I'm a diabetic, I have this exact glucometer, I want to formally check if it's reading correctly, if it's reading accurately. The lab knows what to do. They'll take a sample from your finger just the same. The lab is able to do that. Then the glucometer will compare the readings and they'll say, well, it needs a little adjustment here, and they'll adjust it right then and there if needed. At least that's how they did it for us. Or you can go to the manufacturer or just replace it entirely if things are really that bad. And ideally, you should do this every single year. Well, equipment, yes, it can malfunction. That's normal. It needs to be calibrated somehow. Actually, modern glucometers are a very cool piece of tech. Now there are some that transfer your information directly to an app on your phone. There are special strips that collect blood even if you miss the spot. How do the old glucometers work? If you poke the strip and didn't get enough blood, that's it. It won't work. Goodbye. But there are ones with a second chance sampling feature and so on, for every taste, style, and budget. So if you have an old one and the chance to upgrade, just like with an iPhone, go ahead and upgrade. Take a little bit of care of your health. Well, buy something to make it easier, more convenient, and more comfortable for you. Well, checking it in an app is much more convenient. If you're watching me on YouTube, it means you're an advanced user, which means you can also check your levels on your smartphone. I'm actually often asked which glucometer to choose. Man, there is simply no one-size-fits-all answer. It's like asking which car to choose. It depends on the person. Well, I mean, if you have absolutely no extra money, oh, well, first of all, your insurance provider should have given you some glucometer, right? Along with specific strips for it. If you're buying one out of pocket for some reason, don't just look at the price of the device itself. Look at the price of the test strips, because often the glucometer is cheap, but the supplies for it can be incredibly expensive. How are things going for you guys with glucometers, getting them covered locally or through pharmacy? Let me know in the comments so you can use that as a starting point. If budget isn't an issue, then basically just get a CGM sensor instead of a glucometer. There's this little device that you wear on your shoulder and you can monitor your glucose even 200 times a day with it. It's very convenient, very cool. No finger pricking, it's absolutely great. It can be quite a significant hit to your budget. And for the middle ground, well, if you're still a fan of using a glucometer and pricking your fingers, there are ones now that send all the data to your smartphone. Some have a double sampling feature from the test strip. You could try those for yourself. These are just general recommendations, so people don't write in the comments that it's just ads, and so on. So you choose for yourself now. I've given you the general picture. Now here's a clear step-by-step on how to measure sugar at home. First of all, wash your hands. Second, sit in a warm room for at least 5 minutes if you've come in from the cold. No need to use rubbing alcohol. You can just use wet wipes or something similar. Rubbing alcohol can actually affect the glucose readings. After that, take your finger and prick the side, not the tip. It's much better that way. If you prick right here, it'll always hurt because of the pressure, but if you do it on the side, there's less pressure there. Basically, it'll be more comfortable. Prick the side, then wait a bit for the blood to beat up and bring the glucometer to it. We collect that blood from the side, and that's basically it. After that, if you want to lick it off, go ahead. By the way, you don't have to wipe away the first drop, you can just leave it. It's not really a big deal for us anymore. Check out your great, wonderful sugar levels. They're perfect, of course, because you're subscribed to my channel. I've made so many videos here on how a diabetic should eat, how to live with it and all that. If you haven't seen them yet, make sure to subscribe to me. Give this video a like if you found it helpful.